Okay, so moving into muscles of the lower limb, starting with the first question, what are the muscles that are involved in movement of the subtalar joint? Probably before answering this question, we need to understand what is the subtalar joint and how is it usually formed between which bones. And if we go back to the very first diagram or dissection in osteology that we had today, so you can see here number 7, or this big bone is the talus. Okay, all this bone is the talus, and this is the calcaneus. And the joint between them, it's a plain synovial joint that is called subtalar joint. And it produces two different types of movement. It's called inversion and eversion. Okay, so moving on to the muscles that cause these actions. So you have the inversion, the mostly muscles from the anterior compartment, and these are the tibialis anterior, tibialis posterior, and extensor hallucis longus and flexor hallucis longus, and they need to work all together. So each muscle on its own probably is enabled to make this movement, but they need to work together to produce that. And eversion, so these are the muscles of the lateral compartment of the leg, and these are the peroneus longus and peroneus brevis. What are the structures passing behind the median malleolus? So we have Tom does very nice hats, and the T is for tibialis posterior, D is for flexor digitorum longus, V is posterior tibial vessels, N is for the tibial nerve, and H is for flexor hallucis longus. These are the structures behind the median malleolus. Another question about the structure deep to the external hallucis longus. So that will be the deep peroneal nerve and dorsalis pedis artery. What makes Achilles tendon usually made by the superficial compartment, the superficial compartment of the posterior, the superficial part of the posterior compartment, and that would be gastrocnemius, soleus, and plantaris. Moving on to this, these are the muscles in the foot, and we need to identify a few of the blood vessels as well. So I would like to start by um, from the end. So looking at the big toe, you have sort of a big muscle in here connected to the big toe all the way up, and you are on the dorsal surface, so you are on the extensor surface. So this muscle, which is number 14, will be the extensor hallucis longus. As long as there is a longus muscle, there should be brevis as well. So if you look at this tiny bit, which is coming from the foot in here, and going all the way to the big toe as well, so that would be the extensor hallucis brevis, which is number 13. So extensor hallucis brevis number 13. Well, let's look at the 4 toes as well on the other side. You have a big one, which is coming all the way up from the front of the tibia, which is number 7 in here. This is the extensor digitorum longus. And on the other side, you have a smaller one coming down from the foot, which is this one. Let's track it up there. It will be number 6. So that will be extensor digitorum brevis. Okay. So these are most of the muscles in here, but we do have as well number 5, which is the peroneus tertius. And we're going to talk about the origin and insertion that comes from the front of the tibia and will insert into the base of 5th on this side. And that is the peroneus tertius, which is number 5. And also number 1 is the flexor retinaculum, containing all these muscles in place to make sure they don't mobilize. You have number 2, which is the lateral mal, and you have number 9, which is the medial mal, and also number 10, it's a muscle coming from all the way up in the tibia and then in front of the medial mal and goes into the sole of the foot. So that will be the tibialis anterior muscle, tibialis anterior muscle. So we've covered most of the muscles in here, but there are some blood vessels as well and some nerves as well. So starting by the blood vessels, so you have here, like I mentioned, this is the extensor hallucis longus muscle. You're expecting to find the dorsalis pedis artery just lateral to it. So you look at number 11, that looks like the dorsalis pedis artery. However, this artery continue on the dorsum of the foot and they start penetrating the first dorsal interosseous muscle as a deep plantar artery. So number 14 is the deep plantar artery. Okay, deep plantar artery. And also there is a nerve that we can find just below the extensor hallucis longus muscle, and this is the deep peroneal nerve, which is number 12, deep peroneal nerve, and it continues and it supplies the skin in the first web space in the dorsum. Dorsal is the first web space as outlined in here. So it will end by dividing into two terminal branches, as you see there. That's a branch, and that's another branch, and these are called interdigital branches. Interdigital branches. Okay, so we have as well some arteries on the other side. So number 8 looks like artery, interdigital arteries, and they are coming from the arcuate artery, and this is the lateral mal artery. So it's artery in front of the lateral malleolus, all right? So these are most of the structures on the dorsum of the foot, including muscles and nerves and also blood vessels. Okay, so we've answered most of it. Moving on to this one, it's an even deeper section. So we talked about this white structure, which is a tendon coming from the front of the leg, moving all the way down to the sole of the foot. That is the tibialis anterior muscle. And we talked about 14, which is the extensor hallucis longus muscle. And we talked about 21, which is a nerve just deep to the external hallucis longus. That's the deep peroneal nerve. And 11, which we mentioned, that it's the dorsalis pedis artery. And in terms of 15, it's the deep plantar artery. And there is another branch. So you look at the dorsalis pedis, we'll move all the way down and divide into two terminal. So 19 is called the arcuate artery, the arcuate artery, or the arcuate arch. And this arcuate artery will continue number 8 as interdigital branches, and also the 20. Remember, we mentioned about the first dorsal interosseous being pierced by the dorsalis pedis artery. So these are dorsal interossei muscle. And you know, this muscle is cut. It's a big tendon that was moving all the way up there. This is the peroneus tertius muscle. And obviously that is lateral malleolus, and this is the artery in front of the lateral malleolus. And yeah, that is most of the structures in the dorsum of the foot, and into an even deeper section as a dissection. Okay, so we identified most of these structures up there in addition to other structures as well. What is the action of extensor hallucis longus? So if you look here, it's a muscle coming all the way up from the leg and going all the way down to the big toe, so it can extend that big toe. But it doesn't only work on the big toe because it's passing in front of the ankle as well, so it can dorsiflex the ankle. In addition to that, it can um, invert the ankle. So inversion as well is one of the movements for the extensor hallucis longus. Well, identification of 4, 5, we're still in the dorsum of the foot. So the trick is to get it from distal to proximal. So start by the big toe. You have a big muscle in here, number 7. So that is extensor hallucis longus muscle. And another small one just beside it, number 6, extensor hallucis brevis muscle. Look at in the other toes. So you have number 5, as you can see here, number 5, which is slightly bigger muscle than the number 4. So 5 will be the extensor digitorum longus muscle. On the other hand, you have number 4 is that. Okay, so this is number 4, which is extensor digitorum brevis muscle. Of course, if you want to find the dorsalis pedis artery, it's always lateral to the muscle, which is called extensor digitorum longus. So this is the dorsalis pedis artery. What's its continuation is number 9, which is right there. So that is the interdigital artery. All right, this is the interdigital artery. Okay, and of course it will start piercing the first dorsal interossei, which is number 8, the first dorsal interosseous muscle, pierce it to be the deep plantar artery, which is from there, and also it will form the arcuate artery as well, if you remember from the last diagram. Obviously 17, you're on the medial side. This is the tibialis anterior muscle, and yeah, still 5 will be the extensor digitorum longus muscle. These are some other structures in the dorsum of the foot, very clearly outlined in here. So what is the action of tibialis posterior and tibialis anterior? I think we pretty much mentioned this before. When they work together, they cause inversion of the subtalar joint. And always remember, the inversion does not happen at the ankle joint. Ankle joint is for dorsiflexion and plantar flexion, but never for inversion or eversion. We mentioned the muscles responsible for eversion and the nerve supply, peroneus longus and peroneus brevis, and the nerve supply is the superficial peroneal nerve. And we have a section about all the nerves of the lower limb that will be easily covered as well. Okay, what are the compartments of the leg? So in the leg we have anterior compartment and posterior compartment and lateral compartment, okay? And the posterior compartment is divided into superficial and deep compartment as well. So the anterior compartment has a certain set of muscles, which are 4 muscles, and the lateral compartment has 2 muscles, and this compartment has around 7 muscles, okay? So the anterior compartment is muscles. We're going to come back to it, I believe, in a bit. So the septums between these compartments, if you look in this transverse section, you're starting here by having the tibia. On the other side, there is the fibula in here. And in between, there is the interosseous membrane, okay? The interosseous membrane. Initially, this interosseous membrane will divide the anterior compartment from the posterior compartment. So we'll see this is the muscle of the anterior compartment. It will divide it from the posterior compartment. And in the posterior compartment, we mentioned it's a superficial group and a deep group as well. They are separated by a transverse intermuscular septum, and you have lateral compartment, 2 septi in here, so the anterior intermuscular septum and the posterior intermuscular septum. All right, so you sort of have, like we said, the interosseous membrane, okay, just like that, and then the anterior interosseous, the anterior intermuscular septum, and the posterior intermuscular septum, and then the transverse intermuscular septum. Okay, they look like that. So the leg muscles, this is just a table to divide them very quickly. So you have the anterior compartment. As a general rule, in the anterior compartment, so all of them will be supplied by the deep peroneal nerve. That's all of them, okay? And on the other side, all of them will cause ankle dorsiflexion, and it will add to that for extensor hallucis longus the action on the big toe as well. So all of them for deep peroneal nerve, and all of them for ankle dorsiflexion and foot inversion as well. So these are the down there we have the peroneus tertius, deep peroneal nerve, and ankle dorsiflexion and foot inversion as well. All right, so these are the action and the nerve supply. But in terms of origin and insertion, you have 2 from the tibia. So you have the tibialis anterior and the extensor longus from the tibia, and you have 2 from the fibula, which is extensor hallucis longus and extensor digitorum and peroneus tertius as well. All right, so 2 from the tibia and 2 from the fibula. So the 2 from the tibia, the tibialis anterior from the lateral condyle and the superior 2/3. The other one again is the same, basically the same origin. So the lateral condyle and the superior 2/3 of the tibia. Okay, and then the insertion, the tibialis anterior is the medial cuneiform, first metatarsal, and the extensor joint longus is the lateral four toes in the middle and distal phalanges as well. All right. On the other side, you have extensor hallucis longus, anterior surface of fibula, and the interosseous membrane, and the dorsal surface of base of the distal phalanx of obviously the hallux, which is the big two. The peroneus tertius, base of fifth. Okay, base of fifth is the peroneus tertius, and I think we demonstrated it multiple times into the base of fifth, as you see here. This is the peroneus tertius into the base of fifth, and now you know the origin. It's coming from the fibula, so it's anterior surface of the lower part of the fibula. That's peroneus tertius. About the lateral compartment, you have two muscles, which are the peroneus longus and peroneus brevis, and the peroneus longus. And again, both of them will be coming from the fibula because they are from the lateral compartment, and both of them will be supplied by the superficial peroneal nerve, and both of them will cause foot eversion. All right. So one will go to the first metatarsal, and the other one will go to the fifth metatarsal. So brevis will go to the fifth metatarsal, and longus will go to the first metatarsal. And the cuneiform as well. You arise from the superior 2/3 of the lateral surface and middle part of the lateral surface of the fibula. All right. So these are the origin and insertion. Finally, we have the posterior compartment. There are 7 muscles, and you have the gastrocnemius, soleus, and plantaris as a superficial group. And they have the popliteus and the flexor hallucis longus, flexor digitorum longus, and finally the tibialis posterior as the deep group. Starting by the gastrocnemius muscle, it does have 2 heads, a lateral and medial head coming from the lateral femoral condyle and the popliteal surface of the femur, just above the medial femoral condyle. So basically, coming from the condyles bilaterally, and they have a common insertion, which is the Achilles tendon, and they have common nerve supply, which is the tibial nerve, and they have common action, which is the plantar flexion of the ankle joint. So the main difference is here for the superficial group is the origin. Gastrocnemius is coming from the condyles, medial and lateral condyle, and soleus is coming from the upper part of the fibula posterior surface, and the plantaris muscle coming from the lateral condyle of the femur. All right, this is the plantaris muscle coming from the lateral condyle of the femur. Moving on to the deep group, you have popliteus and flexor hallucis longus, and the flexor digitorum longus and tibialis posterior. So again, they will all have common nerve supply, which is tibial nerve. They will sort of have common action, which is ankle plantar flexion will always be there. But obviously, when you're talking about hallux, you will change it to the toe instead of the ankle joint. So popliteus coming from the lateral femoral condyle and insert just above the soleal line. So it's a weak knee flexion. So this muscle is not really involved in the ankle. And you have the fibula for the flexor hallucis longus, inferior 2/3 of the posterior surface, and go to the base of the distal phalanx, and obviously goes toe flexion and ankle plantar flexion. Digitorum longus, again, posterior surface below the soleal line, and again, this one, the flexor hallucis longus, you can call it as well below soleal line, but above soleal line is the popliteus. So flexor digitorum longus, and will insert into the phalanx and the lateral 4 toes, and they cause toe flexion and so on. Moving forward, let's talk about the muscles in the anterior thigh. And you have a very important dissection in here that has been dissected nicely, showing all the muscles in the anterior compartment of the thigh. And here you need to think about the quads, which is the vastus medialis, lateralis, and quadriceps femoris, and vastus intermedius, and also the sartorius muscle, and the fascia lata, and what's attached to it. So you have in the fascia lata, attached to it, the tensor fascia lata and the iliotibial tract as well. And on the top, you will have some blood vessels and the femoral triangle, and here you can figure out the boundaries of the femoral triangle as well. So I'm going to start with the femoral triangle. So I'm going to zoom in on this one, and you'll find out that the femoral triangle is nicely outlined by the sartorius muscle. So you have the medial border of the sartorius muscle in there. So this is the sartorius muscle. That's the lateral boundary. And on top, you have the inguinal ligament, which is, as you see, is right there. So the inguinal ligament as well. And on this side, you will have the medial border of the adductor longus muscle. So the medial border of the adductor longus muscle. So I'm going to extend this a little bit down as well, just like that. Okay. So this is the femoral triangle. And in terms of the structures inside the femoral triangle, so obviously we mentioned the boundaries, which is number 19, which is the sartorius muscle, as you see here. So this is the sartorius muscle. And one is the adductor longus muscle. So this is the adductor longus muscle. Okay. And in terms of the top, you have the inguinal ligament, which is sort of a continuation of the external oblique aponeurosis. So you have number 4, as you see here, this is the external oblique aponeurosis. Where are the inguinal ligaments? So it's number 13 in there. So 13 is the inguinal ligament as well. Okay. In terms of the content, you have the femoral content, which are femoral artery. So you have femoral artery. I mean, let's start from medial to lateral. You will have the femoral vein and the femoral artery and the femoral nerve. So we'll try to find out where are these structures. So you have the femoral vein, which is number 8, as you see here. So 8 is the femoral vein. And you have number 6, the femoral artery. And number 7 is the femoral nerve. Okay. And obviously 11 will be the floor, the muscles on the floor of this triangle, which be 11 and 15. So 15 is the pectineus. 15 is the pectineus muscle. All right. 15 is the pectineus, and 11 is the iliopsoas muscle. Okay. So again, back to the femoral triangle. So you have the boundaries, which is the sartorius muscle, and medially the adductor longus, which is number 1, and also the superiorly you'll have the inguinal ligament number 13, which is a continuation of the external oblique aponeurosis, which is number 4. And in terms of the content, you have femoral vein 8, and femoral artery 6, and femoral nerve, which is number 7 as well. And in terms of the this number 10, so you can see number 10 is a quite big vein, coming all the way down. I mean, all the way down. It's even continuous all the way down, and it's on the medial side, all right, in the medial side. That looks like a vein. Obviously, we explained before, when we do the dissection, you have the veins will be a little bit darker in color, and the arteries will be lighter in color, like the number 6. So you have number 10 is the saphenous, the great saphenous vein. So number 10 is the great saphenous vein. Okay, the great saphenous vein. All right, so this is the femoral triangle by all its content. Obviously, you have number 22 and 23, which is superficial external pudendal arteries, and the superficial epigastric artery going all the way down to join the femoral, veins. So 23 are veins, right? Superficial epigastric and superficial external pudendal veins, which join the femoral vein as well. So these are the boundaries of the femoral triangle and its content as well. We talked about the boundaries, content, and the floor as well. To continue the image, so we're going to have a few more muscles in the anterior compartment of the thigh. You have number 5 as the fascia lata. And in fascia lata, you need to remember a few things that are connected to it, which is basically 2 things. From the top, you will have the tensor fascia lata, and it looks white and a little bit tense. So this is a tensor fascia lata. And below, all the way down, something continuous with it as well. So you have the iliotibial tract. Iliotibial tract. Okay. So I think, yeah, we pretty much covered all of this. And then if you go a little bit down, so obviously this is medial and that's lateral. So you have 28 as vastus lateralis. So this is vastus lateralis. And 29 is vastus medialis. And 17 is the quadriceps femoris, right? The quadriceps femoris. Okay. And in terms of number 19, we talked about it, which is the sartorius muscle. So on the medial side, just on the upper part of the tibia, you'll have a common tendon or a common insertion for three muscles, which are the sartorius muscle, the GSS, the sartorius muscle, okay? And you have the G, which is number 9, going all the way down there, the gracilis muscle. So 9 is the gracilis muscle, all right, the gracilis muscle. And you have the semi tendinosus as well, will go into the same site, so GSS, the common insertion on the medial part of the upper part of the tibia. So I think these are all the parts or all the data on this nice dissection showing the anterior compartment of the thigh. Okay, so I think, yeah, it's quite important to try to utilize these compartments not only to identify what's on it, but to try to use it to identify if there is anything else that can help you study. So femoral triangle is not, it's definitely not needed here, but if you study it like that, you will be able to remember femoral triangle when we come back to it later on. Actually, I can just go very quickly to the femoral triangle and try to cover the parts of it as well. So femoral triangle, so boundaries, we mentioned that medially you have the adductor longus muscle, and laterally you have the sartorius muscle, and superiorly and you have the inguinal ligament. And obviously for those two, we're talking about medial border and not lateral border. So medial border of both, all right? And also the content, we talked about femoral artery and vein and femoral nerve. And we're going to come back to talk about femoral sheath and how is it formed and so on. All right, so let's go back to our lovely dissection on the top. Okay, so we covered all of this, and you might be asked about origin of a few of them. So for example, rectus femoris muscle, it comes from the anterior inferior iliac spine mainly, and the ilium just superior to the acetabulum. And I can show you this in the histology if you remember when we talked about this area. So it comes from here really. So this is the quadriceps femoris muscle just above the ilium. I mean the lower part of the ilium and the anterior inferior iliac spine. Okay, great. Vastus lateralis, it comes from the greater trochanter and lateral lip of the linea aspera, and vastus medialis, the intertrochanteric line and the medial lip of linea aspera. So we'll have the, if you have the head like that, this is the head of the femur, and that's the neck of the femur, and you have this is the greater trochanter. So it will be sort of like this, and you will have here, this is greater and lesser trochanter, so this is the intertrochanteric line. So for the muscle that the vastus lateralis muscle, it comes from the greater trochanter, and you will have here linea aspera, sort of like that. So you have lateral trochanter, greater trochanter, and lateral lip of linea aspera. That will be the vastus lateralis muscle, and vastus medialis muscle. They comes from here, intertrochanteric line, and the medial lip of linea aspera, just showing like that. Okay. Yeah, we covered all of this. So again, this is a very similar diagram or a very similar dissection. So we're going to go through it very quickly as well. So again, trying to start it as if you're trying to cover the femoral triangle. So you have here laterally, you will have the medial border of the sartorius muscle. So obviously B would be the sartorius muscle. So okay, this one is the sartorius muscle. And medially, you will have the medial border of the adductor longus muscle. So this will continue like that. So A will be adductor longus, B will be sartorius. And on the top, you will have the inguinal ligament, which, to be honest, I can't really see it evident in here. In terms of the content, or that will be the femoral vein, which is F in here. This is femoral vein, okay, femoral vein. And you have E, which is the femoral artery, and you have, D, which is the femoral nerve, okay? And, Yeah, and in terms of G, this is the great saphenous vein as well. And H, you have H and L and J. So in terms of the J, if you remember we had the fascia lata, so that will be fascia lata, and the K will be tensor fascia lata, and the J will be the iliotibial tract, and also the I is vastus lateralis, and the L is the quadriceps femoris, and the H is the gracilis muscle. The gracilis muscle, if you remember, they go all the way down and insert in a common insertion on the upper part of the medial surface of the tibia. Okay, so these are the structures in this side. So another question is asking, remember we talked about the psoas major muscle, or the iliopsoas muscle, where it was here, number 11. This is the psoas major muscle. So in terms of the origin and insertion of the psoas major muscle, so we always remember the insertion as the lesser trochanter of the femur. That's the insertion. But in terms of origin, it usually comes from the transverse process of T5, T12 to L5. So T12 to L5 transverse process. So it will take from all these transverse process like that. Okay. And also we'll take from the discs in between. So we'll take from here as well. And the body of the vertebra, which will be sort of here. And all of these will come together to form a very nice big psoas muscle that will go all the way down and joined by the iliacus muscle to form the iliopsoas tendon, which inserts into the lesser trochanter. Nerve supply, it will take from L1, 2, 3 and L2, 3. So it will take from the nerves which lie in this area. So L1, 2, and 3. Okay. The iliotibial tract, we mentioned the attachments of iliotibial tract that it mainly come from the top, the fascial. So you have here, if you look at this one, so this is the iliotibial tract right there. It's come from sort of iliac crest, and joined by the fascia lata as well, which is this is tensor fascia lata, which is the muscle, and obviously that will be the fascia lata, so it will join fascia lata down there. So origin, it comes from the ilium and the supra acetabular fossa as well, which is right there, and also the lateral condyle of the femur as an insertion. So it goes to the lateral condyle of the femur. So here will be lateral condyle of the femur, lateral condyle of the femur, and it comes from the ilium up there. And it represents good attachment for gluteus maximus muscle. So the gluteus maximus is attached to it, and the tensor fascia lata is also attached to the iliotibial tract. Okay, the clinical significance of this, so it does stabilize the knee, specifically in extension, and it also allows tensor fascia lata and the gluteus maximus muscle to be attached to it. So it represents sort of an insertion to these muscles, and it extends the tensor fascia lata muscle into the lower thigh and leg, allowing its function as one of the abductors and the medial rotator and the flexors of the thigh. So it sort of works like synergetically with other muscles such as tensor fascia lata and the iliotibial tract. So it represents attachment for gluteus maximus in there and tensor fascia lata on the other side as well. Okay, so moving on, the gluteal region and the posterior thigh. So now we covered the in terms of muscles. We talked about the muscles. We covered the feet, and we covered the leg as well, and with all the compartments and what separate between them. And we covered the anterior thigh, but now we're left by the posterior part of the thigh, and also the gluteal region, all right, or the gluteal region. So we need to identify the structures on this very long diagram, so or dissection. So you have here starting from the top. So this is the back of the patient. This is the gluteal region. We're going all the way down. And the diagram even takes more than one page, as you see here. We're going all the way down and up to the back of the knee and the upper part of the back of the thigh. So it's really zoomed in. So I'm going to start by zooming in bit by bit and try to identify the structures. So we mentioned some of them. So if you remember, number 18, this is the tensor fascia lata, which we just talked about, the attachment coming from the ilium up there, and the crest up there as well. And this big muscle, which is going all the way down like that, that is the gluteus maximus region. And we mentioned that the gluteus maximus is attached to the tensor fascia lata, which is one of the functions of the tensor fascia lata. This is the coccyx, which is the end, basically. And this is the anal canal, or the anus. Okay. And we have other muscles as well. Which are tensor fascia lata, and this is 11. It will be the iliotibial tract, and you have number 5 as adductor magnus muscle, right? So adductor magnus is mainly a muscle of the medial compartment of the thigh, but it's still extended backward as well up to the back. Okay, so here we are on the lateral side, and this is the medial side. So we'll have a few muscles on the lower end. So you'll have semitendinosus, semimembranosus on the medial side, and you will have the biceps femoris on the lateral side. So this is biceps femoris, since we are on the lateral side. This is biceps femoris muscle. And on the medial side, so again, we need to utilize this diagram or this dissection to identify the boundaries of and the content of the popliteal fossa. So popliteal fossa is basically a fossa on the back of the knee, and it has muscles from the posterior aspect of the thigh and the posterior aspect of the leg as well. So let's start by that. So you will see that there is a big tendon, the whitish structure in there. That's it's actually very slim tendon, going all the way down to certain insertion on the medial side of our part of tibia. Remember this insertion for the GSS. So that part will be the semitendinosus. So I think the mark will be somewhere here for the semitendinosus. But anyway, this is semitendinosus. The big one, which looks like a membrane, this one. Okay, so this is the semimembranosus. So if you look here, that is the semimembranosus. Okay, so in terms of the boundaries of the popliteal fossa, so you will have the semitendinosus and semimembranosus representing lateral boundary, as you see here. So the medial boundary, all right? So the lateral border of the semitendinosus and semimembranosus represent the medial boundary of the popliteal fossa. And on the lateral side, you will have this muscle, this lovely muscle in there, which is the biceps femoris muscle. So this is the biceps femoris muscle as a lateral boundary. And from below, you will have two heads of a single muscle. And these two heads are the medial and lateral head of gastrocnemius muscle. So this is gastrocnemius, so medial and lateral head. So you will find out now, so you have all of this area as the popliteal fossa, which is diamond in shape. And we talked about the boundaries of the popliteal fossa. But now we really need to cover the contents of the popliteal fossa, and it will have popliteal artery and popliteal vein, and also the tibial nerve and the common peroneal nerve. So look at that big nerve that looks almost like a tendon, and it's in the midline. This is the tibial nerve, and laterally, look at this nerve in there. Another nerve is the common peroneal nerve, and obviously the common peroneal nerve is lateral, and this is the lateral side, and the tibial nerve is medial. This is the medial side. We cannot really see the popliteal artery and vein, and that tells you something, that the popliteal artery is the deepest structure in this area, and the common peroneal nerve is the most superficial structure in this area. If you remember 21, so it will go to the common insertion there. So this is the gracilis muscle, all right, the gracilis muscle. And obviously the sartorius will come in here as well. So we'll have the GSS, so gracilis and semitendinosus, semimembranous, and also the sartorius muscle as well. Okay, so these are these structures on the back of the thigh. Very quickly, gluteus maximus. So it arises from, so gluteus maximus, we mentioned the origin early. If you remember when we mentioned the ilium, which was a big bone, we had a sort of three lines. You had a line in here which is the posterior gluteal line, and we had the anterior gluteal line, and then the inferior gluteal line. Okay, so the gluteus maximus, it arises from the ilium just posterior to the posterior gluteal line. All right, and the dorsal surface of the sacrum as well, and the sacrotuberous ligament, and the insertion, as we mentioned, it goes to the iliotibial tract, which will be on this slide. Nerve supply is the inferior gluteal nerve, inferior gluteal nerve. Okay, and the action, it's one of the extensors of the hip joint and the flexors of the knee joint, and the assist and lateral rotation as well, and the steady of the thigh. Tensor fascia lata, we mentioned the origin of tensor fascia lata as the ASIS, and the insertion is iliotibial tract and the nerve supply. Gluteus medius, it will arise from the ilium just between the posterior and anterior gluteal line, so it would be sort of here, and the insertion will go to the greater trochanter of the femur, and the nerve supply is superior gluteal nerve. And remember this nerve because we're going to talk about the Trendelenburg sign, which is one of the tests that you're going to do in hip examination as well, because this nerve can easily be injured. All right. So yeah, here superior gluteal nerve, Trendelenburg sign, which can easily be injured, and it's part of your examination to the hip joint. So let's talk about some muscles again. So this is the muscles of the gluteal region. You have the gluteus maximus, the gluteus medius, the gluteus minimus. We know that the nerve supply for them, the maximus will take from the inferior, and the medius and minimus will take from the superior gluteal nerve, and all of them responsible for sort of hip abduction and the external rotation, hip abduction and medial rotation, or the other one with hip extension and sort of lateral rotation. In terms of origin, it's quite easy to remember. Remember that diagram that I drawn here. So you have here, this is the gluteus minimus muscle. So this one is the gluteus minimus, and this one is the gluteus medius, and this one is the gluteus maximus. All right, great. And we know the nerve supply for them, and we know the action for them as well. And you just really need to mention those areas. And we know the insertion. The maximus is the iliotibial tract, and the other two will be the mainly the greater trochanter, and the minimus will go to the iliotibial tract as well. Tensor fascia lata, we talked about the origin and the insertion, and the nerve supply is superior gluteal nerve. You have some other muscles, which is the piriformis muscle, obturator internus, and also superior and inferior lamellae, and the quadratus femoris. So in terms of the those are the lateral rotators of the hip joint. So all of them, you will see lateral rotation is the main function for them. Nerve supply for obturator internus, it's nerve to obturator internus. For superior inferior glomeruli, it's nerve to obturator internus plus nerve to quadratus femoris, and that's why we're mentioning quadratus femoris in here as well. Okay. Yeah, so in terms of piriforms, we'll go to the greater trochanter, this one greater trochanter as well, and the greater trochanter. So usually the three muscles, because these are the lateral rotators, the hip rotators. So these are the lateral rotators of the hip. So they will all go to the greater trochanter to laterally rotate the hip. And they arise from, for obturator, for example, it arises from the ilium and the ischium and the obturator membrane. And this one, just read the origin really. But these are the main tricks that you need to know about the origin and insertion of these muscles. Thank you. I think next one will be the ligaments and probably the veins, the arteries and veins as well. Thank you very much for watching.